This is the 11th body found in the grave. He has his dog tag in the position where it should be. And the leg is very interesting because you see that there's a stabilizer placed along the whole leg, and there's a fractured femur with remains of a tourniquet, and you can see there's a round hole which gives the impression that it's probably a bullet wound that completely smashed the femur. We'll see it a bit better when we exhume it in a minute. Hello everybody. Today we're going to speak about a few cases of first aid or emergency surgery that were visible on some of the bodies of German soldiers that I participated in exhuming over the past years. And we're going to go into more details, technical medical details. So this first body that we just saw, it has a splint that covers the entire right leg. You see the splint is this metal thing that goes around the leg all the way around like this. And you can see that there is a fracture here on the femur, which is the thigh bone. So the point of a splint is to immobilize the leg, because once the bone is broken, of course the leg isn't held together properly. So if you try to move the person, then these fragments are going to move. And not only is that very painful, but also depending on the exact type of wound, maybe that can damage an artery, a blood vessel, a nerve, and make the wound more severe. So you put this splint around the leg, the point being that the leg will not move anymore, to keep it immobilized until the patient reaches a surgeon. And what's very interesting with this splint is that you can see that it corresponds very closely to what the guidelines in the period German first aid documents were. You see here they put the splint all along the femur, and here they did the same thing. And here there's also a period picture that illustrates a splint on a leg. So you can see, of course, back then the splint would have been covered up with a bandage and stuff, and on the body that we exhumed, only the metal splint remains. These are the splints as they would have looked like at the time. They're called ladder splints for pretty obvious reasons, because they look like a ladder. And you could bend the splint as you wanted to adapt it to whichever part of the body had been wounded. Now, we saw there's a splint, and then we saw something else. In the video I mentioned that this is the remains of a tourniquet. Now I think that is not correct. I think that what this is the remains of a surgical drain. So what's a surgical drain? When you have a bullet or fragment that goes through a limb, like illustrated here, you have a wound track. And in war conditions, or even in normal conditions, there can be, an infection or bleeding going on at any part of that track. And what happens is that if you leave the wound alone, the skin might heal very fast, but deep down in the wound there might still be an infection going on, for example. So the surgical principle for somebody with a gunshot wound that may be contaminated is that you don't want the skin to close. What you want to do is to keep the skin open, so that if there's an infection or if there's some bleeding, that the blood and the pus can drain out. Because if you close the skin when actually there's an infection going on in the inside, well then that's going to be very bad. The infection is just going to get worse. So to do this, what the surgeons do, even though it seems counterintuitive, is they put a drain inside the wound that prevents the skin from closing up, and it enables any pus inside the wound to drain outside. So in retrospect, I think that little piece of rubber that was visible during the exhumation were the remains of a surgical drain. And last interesting thing, once we removed the bones from the ground, inside the wound, you see the wound is pretty small. Inside the wound there was still a metallic fragment, which apparently is a shell fragment or a grenade fragment, something like that. And this is a period illustration made by the US Army, showing all the fragments that are produced by the explosion of one single German 88mm shell. So you can see it makes hundreds of fragments, and even one of these little fragments, depending on where it hits you, is enough to kill you. See, this guy was hit in the leg. You would think that's not such a bad wound. but it was enough to kill him. I don't know if he bled out or if he died of an infection, but just his femur wound was enough to kill him. And I actually have this soldier's period military file, and his wound is only a thigh wound. He was not wounded somewhere else. We're done excavating the third body here that had the splint on the arm. And if you look here, so he has the splint like this going all on his forearm, going up on the arm, and the forearm here is smashed, both the bones. And here there's a piece of rubber, which is probably a surgical drain that the doctors put in there. On this body with the arm splint, we see the exact same principles illustrated again. What's neat is here there's a period photograph from a German medical manual, and you can see that the way they put the splint is quite similar to what's visible on the body. And this also illustrates how these splints could be bent as needed, so that you could adapt the shape of the splint to the exact wound and the exact anatomy of the patient. And we also saw in the video that there's remains of a drain inside the wound that's visible here. And what's neat about these drains is that these are pictures of them once I cleaned them. You can see that they're very large. And anyway, nowadays I've never seen such large drains being used. And my guess would be that these are not official army issue drains or medical drains, but they're just some kind of rubber pipe that was found in the field that the surgeons decided to use because they probably were running out of equipment. Here there's more examples of splints. So this isn't a very nice picture, but the thigh is up here. Down here it's the tibia, so the leg bone, and then the foot is over here. And if you look carefully, you can see there's something rusty, which is a metal splint going all along the leg and then up here following the foot. And this is quite neat because once again it corresponds almost exactly to the advice given in the period German medical manuals. You can see this is for, they say, for shin wounds, tibia wounds, and the splint is placed almost in the same way as it is on our body here. And then once again, if you look at the tibia from close, you can see that there's a fracture, and in the fracture they put another one of these very large drains. This is another example of a splint. This is on an arm, so it's a much less heavy-duty splint. And what's neat about this one is you see, instead of putting the splint so that it follows the arm exactly, by the way, you can see the forearm is broken here. Instead of putting the splint so it follows the arm, you see it makes this big bump here. And my guess is that this guy also had a flesh wound going with this bone wound, of course. So they would have put a bunch of bandages around the flesh wound, and then they put the splint on top. So they had to adapt the shape of the splint to the fact that there were bandages there. That's my interpretation. And this is one of the arm splints seen from close up, so it's just this kind of flimsy aluminum. This is the other side, and you can bend it into the shape that you need. And to conclude about the splints, this is a German World War II era manual picture showing all the various splints that could be put on a person. So depending on where the wound is, if it's upper arm or upper leg or lower leg, you adapted the splint as needed. And you can see that even for neck wounds, you could actually have a splint around the entire head to prevent the head from moving. This is the 8th body that we find today, and this one is the most interesting so far when it comes to seeing wounds on him, because you can see that on the left leg there's 2 tourniquets that have been put into place, and the leg is smashed in both those locations. There was a shrapnel fragment here that we found when we were digging. And there's also a tourniquet in place on the left leg, that pink stuff you can see. And the lower leg is smashed completely. Apparently the foot is actually missing. So this guy would have probably bled out, even though a total of 3 tourniquets were put in place by the medical team or by his friends. For this body, you can see that some pretty desperate attempts were made to save his life, but unsuccessfully. The first thing is, once again, I mentioned in the video that this pink stuff is the remains of a tourniquet. I don't think that is correct now. I think that these are also the remains of a surgical drain. So there's probably just a flesh wound here, because you can see the bone is not broken, and they put a drain into the flesh wound for the reasons I explained previously. And then on the other leg, as I mentioned in the video, there's two tourniquets. So first of all, what is a tourniquet? Tourniquet, the word comes from the French word tourner, which simply means to turn. And the principle is that if you have a wound somewhere that's bleeding uncontrollably, what your point is to compress the arteries above the wound so that the wound will stop bleeding. And the best way to do that in most cases is to put a tourniquet, which is just a very tight binding around the limb above the wound that compresses the arteries and veins, and then hopefully will stop the bleeding. This is a period German illustration of a tourniquet being used around the thigh, and you can see that the nurse is also lifting the leg up, because that will of course decrease the blood pressure in the limb and help stop the bleeding. Of course, this guy is just an actor and he doesn't have a wound, and you can imagine that if he had his thigh blown apart or his tibia blown apart, the scene wouldn't look as pretty as it does here. So these are the two tourniquets. Like I said in the video, what's very interesting is you can see that the bone is fractured here, and the bone is also fractured up here. See, there's a bunch of little fragments. And at both locations, for the bone to be broken, there would certainly have been a flesh wound as well. And you can see that they put tourniquets at both locations. This one is a bit hard to see, but there's pink rubber, and then this one is very easy to see, and you can see it's this kind of brown rubber. And these are the tourniquets once they've been exhumed. So you can actually still see the knot that the guy made back in 1945. Here you can still see the shape of the bone within the tourniquet. This is the other tourniquet. You can also see the remains of the knot that was made, 80 years ago by somebody who was trying to save a life. And you can see the shape where the bone was here as well. And what's interesting with these two tourniquets is you see that they're made of different colors of rubber. And I think once again that these are just field improvisations. The medical team just used whatever rubber band they happened to find in the field. And these are not official German army issue tourniquets. They actually did have official ones, and they looked like this. So you can see it's a rubber band with these little plastic clips. And if you look at the period documentation, you can see illustrations of this. See here, they're showing a tourniquet on an arm, and you can see it has these little plastic clips as well. And on some other femurs that we exhumed, so these are thigh bones that were broken. We found a couple of them with tourniquets in place, and you can see that these are the actual official tourniquets with little holes in them. This is another one. The tourniquet was around the leg, and once we exhumed the tourniquet, you can see it has the little white clip and these little holes, just like the official tourniquet, the army issue tourniquet. So this is neat because you can see that the surgeons or doctors had to improvise and recycle things in the field according to equipment that they were lacking or that they had not received. Here on this soldier's arm, there's these pieces of rubber that looked like they were probably a tourniquet, but we didn't find any wounds on the actual bones. That might be a cause of death though. As you saw in several of the previous cases, what I said as I was filming was actually wrong, because when you're in the field then you're filming, but you didn't have the time to think and analyze things properly. So I said a bunch of things that were mistakes, and this is the same here. I said the guy had what looked like the remains of a tourniquet around his arm. But if you look here, what you actually have is these strange tubing, not on his arm, but like in between his arm and his chest. And I have to admit, this remained a mystery to me for quite a while. This is what the stuff looks like once it's exhumed and cleaned. So you have this long rubber tube, and then this sort of piece of waterproof rubber, which is quite strange. So this remained a mystery for quite a while, until the day I found out that this soldier's cause of death was a gunshot wound to the chest. And then I understood what this stuff was. I understood that this stuff is probably the remains of a chest drain. So what is a chest drain? Let's go into a bit of anatomy for a minute. You can see that this is the lung here, and these are the ribs. And in between the lungs and the ribs, you have what is called in medicine the pleural space. So what that space is actually an empty space usually, where between the lung and the chest cavity, you have basically a bit of liquid that acts like oil, like lubricant. And then you have this space that is empty and that is actually a vacuum. And what happens is that when you breathe, your ribs move, and this space is between the lungs and the ribs. But because it's airtight, that forces the lung to follow the ribs. And this system is very nice and works very nicely until you have a gunshot that goes through the lungs and the ribs. Because the space is no longer airtight, so the vacuum is destroyed. And what happens is that air comes in from the outside and also comes out of the lung that's wounded. And if the lung is bleeding, then a bunch of blood also comes out. So what you have is this space that's supposed to be empty and airtight that fills up with blood and air, and that's what is called having a pneumothorax and a hemothorax. And when you have this, it's no good, of course, because that means that you can't breathe properly. So the medical treatment for this is to insert a chest drain. So that simply means you open a small hole between the ribs and you insert a tube into the pleural cavity and suck out all the air and blood so that the lung can re-expand and the person can breathe properly again. That's the treatment. Of course, this only works if the bleeding is limited. If the person is bleeding too much, then you have to have a surgeon go in and actually stop the bleeding, because otherwise your chest drain will just suck out all the guy's blood until he's dead. And so this is the standard effects and treatment of a gunshot wound, having this blood and air appear around the lung, and then putting in the chest drain. So once I found out the soldier had been hit in the lungs, I understood that this tube is probably the remains of a chest drain. You can see that to prevent the tube from getting blocked with blood clots and stuff, they have several little holes along it. And if we look at the tube found in the soldier, it also has these extra holes. And then there's this piece of rubber that we can wonder about. So I'm not sure what this is. I suspect it might be something that the doctors had attached around the chest drain to keep it airtight. Because the point of the drain is that it has to be airtight, of course. You don't want any more air going in the lung. So that might be what it is, but I'm not sure. And this here is a period German drainage kit. You can see it resembles what we found quite a lot. And I'm not exactly sure how this was supposed to be used, but you can see that it's very sharp. And anyways, nowadays I worked in surgery for a couple of years, and we were not allowed to use something this sharp, because what happens is that when you try to insert your drain with something like this, well, if it's so sharp, then you might just penetrate the lung by accident. So this is not supposed to be used anymore nowadays, or at least not in the hospital that I worked at. This first body must have suffered pretty horribly before dying, because if you look at the legs here, both of them have been amputated just above the knee. So presumably he was severely wounded in the legs, and then some surgeons cut them off, and then he must have died and they buried him. He was buried in a shelter quarter, because you can see the loops and the buttons from shelter quarters that we found with the body. I didn't see an identification tag on him yet. This soldier here, as we just saw in the video, had a double leg amputation. And if you remove the legs from the ground and look at them from close up, and look at where the surgeon cut, you can actually see the saw marks from the surgeon on both of these legs. Kind of painful just to look at. And what's interesting is that when a surgeon is doing an amputation, the patient is usually lying down, but there's always a bit of tension left on the bone. So what happens is the surgeon saws through the bone, and then when he saws through almost all of it, through 95% or something, then the remaining bone isn't solid enough to hold the tension of the leg, and then the bone just snaps off. And that's what we can see on these legs here. You can see that the surgeon sawed through almost all the bone, and then when we get to the bottom, the bone snapped off, and that's what we call a breakaway spur. So this is normal to observe in cases of amputations. This is another amputated limb. So this is the tibia, the shin, which is intact, and then down here you can see that they sawed it off at the bottom and cut off the guy's foot. Presumably he had some kind of foot wound. The first interesting thing we see is that there's remains of a surgical drain that were found near the amputation site. And that's very neat because nowadays the surgeons do the exact same thing. If they amputate a limb, then they have to close the wound up, and usually there's a drain left inside for a couple of days so that any blood or fluids can come out, and then the drain is removed. And then the second interesting thing is that you see when a surgeon cuts off a bone, afterwards he has to close the skin up on the wound. And the thing is that when you saw a bone off, well, the edges of that bone are usually quite sharp, and the risk is that when you close the skin back up, the bone is so sharp that it might damage the skin and then cut back through the skin, and you want to avoid that, of course. So what the surgeon usually does after sawing the bone is he takes a file and he files all the sides of the bone to make them blunt and to minimize the risks of the bone going back through the skin. And if you look at this tibia that was amputated, so once again you can see the saw marks through most of the bone, and then you see the end, the last bit just snapped off, so you have the breakaway spur. And then you can see that the surgeon also filed the bone. If you look at the top part here, you can see that it makes these kind of little waves, and that's where the surgeon used his file to file off the bone to make it less sharp. And of course, in normal circumstances, the surgeon would have filed the bone off on all sides. And presumably because he was in war conditions here, you can see that he just did half the job. He only filed off the top part of the bone, but all the lower part he didn't touch. And then if you look at the other bone, the fibula, you can see that here he just sawed off like about 40%, and then he just snapped the rest off and didn't file anything. Or actually, no, I'm saying something wrong. Here you can see that there are some file marks, just a few of them. So basically the surgeon who did this was in a rush. Here we found something extremely interesting. At the feet of the 12th body, we found a piece of femur that had been sawed off, so obviously an amputated leg, and then we noticed that there's actually an amputated tibia and part of the femur buried under the body. So you can see that this is the foot here, this is the tibia, and here it's all smashed into small pieces, and then up here there's the amputated femur. So they must have seen the wound was too severe and they sawed the leg off. You can actually see the saw marks, and you can see that the surgeon sawed 90% and then the last piece just snapped off on its own. So somewhere in Germany there must be a guy with a leg missing, and this is his leg right here. There's also a small piece of shrapnel that was found near the wounded area. For this amputated leg, after removing it from the ground, I put it in anatomical position to take a picture. And now you can see much more clearly where the wound is. So this is the foot, this is the tibia and fibula. And then up here there's the knee and the femur, the thigh. And you can see that the upper part of the tibia is completely smashed into multiple pieces. During the exhumation we also found a few little remains of shrapnel. Here you can see on the bone there's also iron stains left over from shrapnel fragments. So this is apparently damage that was caused by shrapnel. And when the surgeons saw this guy's leg, they must have understood that this was way beyond repair, especially for 1945. And so they sawed the leg off above the knee. And if we take a look at the saw marks, well, once again it's the same thing. You can see how it was sawed through, and then the last piece just snapped off on its own. And then if we look at the bone from very close up, you can actually see scalpel marks from the surgeon. See these straight lines. So this is from when he was cutting the flesh. He also touched the bone, and it left these straight lines on the bone. So this surgeon probably died, 50 years ago or something. but his scalpel marks are still visible today. He probably would never have imagined that 80 years after he did this amputation, people would be seeing his saw marks on YouTube. That would have been totally unimaginable. Kind of interesting to think about. And then down here the bone is also damaged. You see, this is done by roots in the ground. They come near the bone, then try to eat the bone, so it leaves these more irregular marks on the bone. Here there's some World War II era scalpels that would have been used by the German army and that would have left the marks on the bone that you saw. And these are the German army saws. So you can see that this is, let's say, regular kind with a straight blade. And then there was also the possibility of using this type of supple saw. So you see what it's illustrated here, how they could do an amputation with that as well. This comes from behind and then it also saws through the bone. And if you look at the bones that we found, you can see by the straight marks on it that this was cut with a normal saw and not with that supple version. So these would have been cut off with a normal blade, as is visible here. Now we've seen several cases of people who had first aid or emergency surgical treatment that didn't work, of course, since we found them buried near the front lines. These are all guys that didn't make it. And along with these bodies, we also found a few cases of bodies that had clearly died immediately on the spot, so they didn't have time to suffer. This is one example where a guy had a shrapnel fragment come in one side of his head and go right out the other, so you can imagine that he would have died on the spot. This is an example of a guy who's completely blown to pieces, so obviously he also didn't have time to suffer. And then this one was kind of eerie to look at. You see that he's buried in a coffin. All his lower body is completely intact, nothing is broken. And then the whole upper part of the body is completely missing. There's not even pieces left over. So he also must have been blown away immediately with no time to suffer. And speaking about suffering, we'll go back to this guy who had been wounded in the legs and had both his legs cut off. If you think about this guy for a minute, he probably saw both his legs were mangled. He probably saw that he was going to have them amputated, that at best he was going to be a cripple for the rest of his life. At worst, he was going to die. And of course, he didn't make it. He was buried in a mass grave, left in foreign soil for 75 years. And I'm a forensic pathologist and I see dead bodies every day. But seeing this sort of wound, even on a skeleton, I find shocking. You know, you can imagine the anguish, the pain, the suffering that this person went through before dying, and you can wonder, how could anybody deserve to die like this and end up like this, you know? This is just a soldier. I don't know who he was, of course. Maybe he was a horrible person. Maybe he was a great person. I have no idea. But I don't think anybody deserves to die like this, and so we should think twice before sending people out to wars to get killed, especially enlisted people who aren't even volunteers. So that's the end of this video. I hope you found it interesting and learned a few things. And if you want to contact me for help with World War II researches or about anything else, you can simply contact me at this email address. And I wish you guys a nice day. Bye-bye.